and a warm welcome to this episode of Digital Dialogues powered by CXO Digital Pulse. Healthcare is undergoing a revolutionary transformation through technology. Advances in artificial intelligence, telemedicines, and big data are enhancing diagnosis, treatment, and patient care. All these innovations are promising more accurate, more efficient, and a more accessible healthcare, reshaping our approach to well being. And to further delve into this space, we have today Mr. Rajeev Belani, who is the Chief Technology Officer at Wellness Forever Medicare Limited. A very warm welcome, Rajeev.
Thank you, Pratik. Thank you, Ria. And thank you for being patient with me. I know it's been in the works for a while. Happy to be here. Glad to give out anything that I can help with. Over to you.
Thank you so much. And with that, we start with our first question. So, understanding the overall ecosystem of healthcare and how these emerging technologies and innovation and are contributing to it. So, how has been the overall journey with it?
So, for good reason, there is a lot of buzz around AI as a core deep tech that is going to sort of probably end up solving a lot of use cases of problems that we've not even spoken about till now for a while now. However, I think when we talk about AI in healthcare specifically, most people end up talking about primary healthcare. Most people sort of the instant connect is about what the doctor eventually gives them because that's their experience over the healthcare means, right? Healthcare is obviously a lot broader than that. There is healthcare, even if you don't like to talk about it, is also essentially a logistical platform where there is a lot of resources that eventually come together to be able to provide the right kind of sort of treatment for the treatment, medicine, so on and so forth for the end user. So AI, ideally speaking, is extremely useful. There are a lot of models being generated right now. But primarily, I think from my perspective, a lot of the use cases that will be solved first is what I like to call the AI back office of sorts. Because that's where guided AI is going to be the most accepted because it's sort of the least risky in some way, right? You will see a lot of hotspots of development that is happening across the board I mean, I'm assuming everybody's kind of gone over videos where there is AI guided procedures being done just as a demo and AI guide and somebody out of chat GPT is diagnosed himself or herself or so on and so forth, right? Basically. But as acceptability is concerned, we have a lot of low-hanging fruits right now as far as healthcare is concerned. So as an example, we were just talking about the fact that inventory is a problem, right? And people who live in big cities obviously don't really face it as often. But Wellness Forever, for an example, is in 400, has 400 stores. It's in deep pockets of Maharashtra somewhere. And managing inventory and managing the fact that there are certain medication available in certain regions of Maharashtra is not very easy. And we use a lot of heavy lifting in the back end over here to make sure that it is sustainable, economical, and also we keep patient healthcare as sort of primary and make sure that as much as possible that is made available. We will see AI implementations in logistical, sort of retail kind of options, and also in being able to make sure that you get the right insurance, for example. So I think that's where you will see these kind of being implemented before it gets into primary healthcare.
So when we talk about supply chain, it's again data which is getting updated, be it from the retailer side, from the manufacturer side, or from the consumers, the patients. So when all this data is being collected, what are the nuances of the data? Because a lot has been now talked about data privacy, keeping it secure, and especially when it comes to the medical aspects, the health aspect, that is again a very confidential aspect for the patients. So how do you enable so that the data is being collected properly, safely, ethically, and doesn't have any bias when such models have been created for AI for logistics aspects?
I think one of the challenges I know that data governance is a big challenge when it comes to artificial intelligence. But because of the domain that we are in, right? We are in healthcare. there is a lot of regulatory policy that are already there, and there's a regulatory board, right? Basically, that sits on policies, which is right at, I mean, yeah, at government levels, right? Basically, so on that front, I think we are probably looking at a lot of headwind rather than actually sort of the other way around, where everybody's kind of running helter skelter to figure out what to do and how to save data, right? Basically speaking, we have certain very legacy based data governance, data security policies already in play. So on that front, I think there is no other barrier. I mean, it's technically legal and sort of structural in nature. We are lucky there in some sense to say that, you know what, at least we have something which may have gotten a little overboard. It may need to be relaxed a little bit, but it still works, right, basically speaking. And we still have some time for everybody to come up to speed, understand what the nuances, what the impact of AI might be, and yet be able to kind of then allow AI use cases to reach the consumer. Now, having said that, I think let me give you a certain example of what we are doing over here with the data that we have in hand, right? We also have to follow a lot of protocols with respect to personal information. But one of the use cases we thought about was something called outbreak detection. Now, outbreak detection is not new, obviously, but outbreak detection based on a certain type of signal, which is unique to a pharmacy, is something that we wanted to work on. Our idea was that pharmacies are essentially a bellwether in terms of what problem there might be at a hyper local level, because what we have as signals are concerned, which are very strong signals, are what medicines are being sold. Now, in that there is a lot of insight that is obviously hidden, right? So with that being the case, the idea was, could we derive certain insights on if there is a certain trend of medicines being sold, can we actually figure out if there is a certain kind of a local epidemic that is being sort of that is befalling a certain zip code at a zip code level, right? Basically speaking.
Okay.
Now, in this, if you think about it, a lot of information in terms of PII information is not being used, right? What we are using is our invoices at the end of the day in terms of what is being sold. And we're training our model vis-a-vis our historical data as to what the actual sale trend might look like. And we obviously have our masters in place and sort of understanding in terms of if there is certain medication being sold in a certain combination and that and the other, then it amounts to, okay, this kind of a disease or this kind of infection is being spreading in a certain region, right? Basically speaking. Now, what even this use case, right, where we've not used any PI information, in our opinion, is a very, very important use case, because this kind of flows into, for example, if we are able to successfully predict to a certain degree that there is a certain epidemic being spread in a certain zip code, right? So you live wherever in Delhi, Bombay, wherever it is. And if you're able to predict that, you can actually intimate a lot of different stakeholders that might need that information coming up to them. I think as far as in healthcare is concerned, I think one of the advantages that we have is the fact that there is already a standard that is available, which is called as FHIR, FHIR. So the heavy lifting of knowing everybody kind of coming on the same board on the same page in terms of what is the standard that we are going to exchange data in is available, right? Basically. So I see that not being enough as big of a challenge, especially with the ABDMPs coming through, because a lot of companies across India specifically are already on their journey to kind of make themselves FHIR compatible, right, with terms of exchange of information. So the challenge for a lot of people who are doing this is going to be to able to get to a quick sort of use case that can deliver value instantly, and that is, I think, what we are trying to work on. Hopefully, it will be sooner than later, because as far as the tech is concerned, as far as where we are right now, this is the first time where everything has come together. I think AI has been in the works for a while now, but it's the first time we've also got the infrastructure at hand, the critical infrastructure at hand in terms of sort of compute power and so on and so forth, that these can actually be applied sustainably and economically, right? So with this, if your goal is to be able to provide the right kind of healthcare, then obviously the kind of so opportunities are endless. I actually am associated with a certain stem cell research company as well, where I kind of have some insights on that. They're also working on on IVF, right, or sustainability or success ratio of IVFs basis certain machine learning model that or data that they have basically. So they put in models to understand if this cycle of IVF will be a success or not beforehand, right, with the parameters at hand. That is a huge amount of that is a very, very big piece of information. If the accuracy of this can be increased, then I mean, I don't need to spell out how big it is for the actual two people that are going through it, right? Basically speaking.
So this is all about the usage, proper usage of data to make a model and implementing an artificial intelligence on it. But moving to the next or the gray area, which is overuse of these models or the artificial intelligence. How do you foresee this?
That's an interesting space, to be honest, because I don't think anybody who's in the sort of using AI is part of this entire ecosystem or not will be able to give you a very, very honest answer in terms of to say that they know what's going to happen. But I can take an educated guess if that is what if that's good enough, right? Basically. So, across the use of AI or development of AI, there are couple of things that everybody is a little bit worried about, right? So one is around bias, and bias can be of two types: intended and unintended, right? Basically speaking. And when we say unintended, the idea is that as a corporate or as somebody who's working on artificial intelligence, we are looking at data being sort of bits and bytes, right? However, those bits and bytes represent a certain section of society, if you think about it. Now, if we don't have governance policies that can help us with making sure that there is a fair sort of representation of different sections of audiences, then the model itself that will generate will be incorrect or may not be applicable to certain sections of the audience. So, to your question, in terms of whether AI is being overused, probably the regulations will take care of it. But in the meanwhile, the biggest challenge we face is going to be how to ensure that there is fair representation across different sort of different types of people, so that the model eventually, when it is generated, is actually being used or can be applied to the entire planet and not a certain subsection. That's the first thing. The other big problem that I see is that sometimes AI is being used for augmentation of lack of skill set, if that makes sense, right? So especially, I mean, I'm sure a lot of people wouldn't have realized this before ChatGPT came in. But with ChatGPT, there are a lot of these different small little jobs that are being completed by the tool itself, right? Basically. Now,
Yes.
like we spoke about, that it's all okay when it is being applied for a creative on Facebook, right? But that should not or cannot be applied in something as critical, let's say health, even logistics or healthcare, right? Basically, there is a certain danger associated with all of this. So there is no answer to this right now. The best minds in the business or the best minds in the industry are working on these two problems, especially something called hallucination. The biggest challenge with using something like a chat LLM tool blindly is hallucinations, because the AI believes it's the right answer and gives it to you thinking it's the right answer, but it is completely wrong. And there is no way for the AI to know it is the wrong answer, right? Basically, we are, I think, about a decade away where before we can get into any kind of confidence about being used without any guidance, right? So, especially on critical sort of domains, including healthcare.
Okay. Thank you so much, Rajiv, for sharing those inputs. And we must say that artificial intelligence is definitely revolutionizing verticals, especially the healthcare vertical. And we need to understand that the core, it's the data which is sitting.
Yeah.
We need to ensure that we have an AI ready data with us, which is accurate, ethical, and structured, so that the outputs are usable format. And with that, there's also a twist that it's a double sided sword. In one side, it will definitely help us, so how ethically we are using it, and on the other side is the unintended or an unethical usage, which we need to have regulations and compliances in place. And I'm sure if it's been all used in a correct format with a very good intention, it will transform healthcare and well-being as a sector to the core, impacting everyone across the globe.